Dr. Lee, periodontal disease. Let's talk about periodontal disease. Here's what I constantly hear from dentists. Dentists keep telling their patient that if they have periodontal disease, they will eventually lose their teeth. A year, 2, 5 years. It all depends, on the body, on how he reacts and how fast this whole disease is going to spread. Now, while losing the teeth is a very bad thing, here's one thing I have noticed. You dentists can make wonderful implants, wonderful dentures even, denture-supported implant, which are just about as good as implants apparently, and yet, much cheaper. So the point is this. You guys can really fix it well. And people these days are not so cautious anymore or conscious anymore about having a formed thing in their body because, we put contact lenses in it, we get hip. People see people getting hip operations and they 2 days later literally dance again. Or maybe a week later, very fast. So people, it's not a wooden tooth like Washington apparently had it, that must have been awful. So the point is, you can do it well. But here's what I see, and you tell me whether I'm wrong there. When you have a gum disease, you have that ugly yellow pus in your mouth. Like when you cut yourself and it gets all infected and it blows up and it's yellow, reddish, ugly pus. Well, you have that in your mouth. And the mouth is the gateway of the blood vessels. When a person is like unconscious, go and put something under his tongue, under his, and he goes, ooh, I'm back, what happened? Because it goes right away in the blood vessel. And that's where that ugly infection sits, and it drips into it, or it gets mixed up with the steak, nicely chewed up, and it gets in the stomach and goes from there all over the place. And here's what I heard it creates. Kidney failure, liver failure, diabetes problem, premature babies which then have underweight babies. Immune system is completely going down, which then of course opens the door for flus and everything. So basically those things simply cannot be repaired all that easy anymore. We know that. So wouldn't that be a much bigger problem than losing the teeth? Never mind that you probably stink for a couple, 2, 3 years all the time, Tell me, how far off am I with this assessment here?
You're very right on that. Periodontal disease, it's just an active infection. It just happens to be in the mouth. If you had a boil on your skin, or if you found out that you have a disease where some of your bone in your arm is starting to become eroded away, it's something that you might want to act on.
People would go to a dermatologist if they have a time of a little pimple which doesn't go away for a couple of weeks, as they should, no problem, as they should. But here they have a huge infection in their mouth and they don't go anywhere with it.
Right, and even on top of what you were saying, periodontal disease, it's also been linked to pancreatic cancer, to respiratory problems like COPD, where they have problems breathing. It's becoming a big problem. It affects the whole body. When your body's sitting there trying to fight that infection in your mouth, it can't fight any other pathogen out there. So, you might tend to get sick more easily.
Yes.
You might feel more tired and drained all the time. That pus that's coming out of your gums, the type of bacteria that cause the gum problems, they release sulfur compounds, so you get that bad breath where no matter what you try to do, it doesn't go away. It causes a whole host of problems. And, because it doesn't cause pain necessarily, people can lose all their jawbone around their teeth and not even have a care in the world regarding that. So, when it's in its very mild stages, we want to make sure that it's treated. We don't want it to start, eroding the bone away around the teeth and the gums. So, if you do have it, we'll let you know that it needs to be treated early, and we'll go ahead and talk to you about some of the problems associated with it.
Well, which, we just kind of mentioned. And those problems are much, much more irreversible than a loss of tooth, which, as I said, at least implant technology became very good. It's kind of, I mean, here's what, have you noticed that lately in the last, couple, 2, 3, 5 years, give or take, that more and more surgeons, the people who take out appendix, a tonsils, or who do a hip replacement or a meniscus knee operation, that those people more and more insist before they do the operation that the person goes to a dentist and get a clean bill of health in the gum disease area, not so much about a cavity or a crooked tooth or needing orthodontic. They don't care about that. But when it comes to periodontal disease, because they have noticed that if the person has periodontal disease, that their wound might get infected, number one. And number two, the body is so weakened that the whole operation, the body couldn't stand. Everybody knows that if you have a weak body, that if you have a lung infection going on and a big cough, a big flu, nobody will operate you while that is going on.
Right.
Apparently a gum disease is just that.
Right, it is. It's the equivalent of having, the volume of tissue you have in your mouth, it's basically from roughly about your wrist to your elbow. That's a lot of volume of tissue you have in there. So if you were to imagine that part of your arm is infected, it kind of makes you think twice, I should probably really get that treated. People who say they have bleeding gums, once in a while when they brush their teeth, having anything bleed on your body isn't a normal thing. Now, regarding what you're saying about getting operations, it's true. People who have joint replacements, heart valve replacements, those people are they're prone to having those surgeries fail because if they have too much infection in their mouth as well. People who before they go through chemotherapy for cancer or radiation therapy, their doctors can send them over to their dentist and make sure that all the gum disease is treated. We don't want to have the active infection when their immune system will be compromised because their body won't be able to fight that so well, and then they start to get a really bad overgrowth of bacteria in their mouth. So, gum disease is just like any other disease. You want to get it treated. It's not something to let go. If you find that you start to get a little bleeding around your gums when you brush and floss, it's something to take seriously because it is a part of your body that is bleeding where it shouldn't be bleeding.
Wow. Yeah. Well, I think it is important to get that message out to all of us, simply because poisoning your body slowly, and getting the immune system down slowly just isn't a good thing, because that next swine flu, bird flu, never mind swine flu, bird flu, but that next really heavy flu season is going to come. There's no doubt about it. Right. And if you're immune, like I was reading from Japan, a university, they said a person with HIV, can get AIDS much, much easier because the immune system down if he has periodontal disease. Because the immune system is down. Now, thanks God, not everybody has HIV. Thanks God, like things such as in California, a baby being stillborn because of finding, gum disease in the placenta. All those are way out there things and don't happen every day. But if those bad things can happen, then very obviously the everyday being, as you mentioned, fatigued, tired, exhausted, a little more sick. Who can afford that in an economy like that? Who wants it? You know what I mean?
Right.
Who wants to be tired? So maybe basically, instead of needing a pick me up in the afternoon coffee or whatever, maybe just get your gums fixed and you'll have more energy.
Yeah, I've had plenty of patients come in. I remember this one lady specifically. She's a little elderly. She goes to her doctor. She's always tired. She feels like she can't breathe, and she doesn't know. The doctor can't figure out what's going on. We saw that she had a big infection in her gums. To the point where some of the teeth, they had no more bone around them. We took those teeth out. Literally the next day she comes in and she just feels a lot better. She can breathe easier. She's not so tired, and aside from that one patient, we have a lot of patients that come in, they're just really drained. Right. And they have a lot of infection in their gums. And once we clean them up, they feel a lot better. So it really takes a big toll, that infection in your mouth.
Right. I mean, anywhere probably, but probably so much more in the mouth because it's at the gateway of the blood vessel. And as you said, everybody will go with a pimple to a doctor and a dermatologist, but not with this. So there it stays, and it's huge. You mentioned it's like huge, like your hand, and etc.
Right.
And that, we don't realize that it's those effects. Well, again, thank you very much for shedding light on this very important matter. It's not just about the teeth. It's the rest of it which affects. Thank you very much.